Hello everybody, a very good evening to all of you. I'm Zainab Millwalla, speech language pathologist, and I am the founder of the ZM Speech Care Clinic in Chennai. I have been working as a speech language pathologist for the past 19 years now, and my interest is towards OSM, that is oral sensory motor therapy for children with feeding disorders and with speech disorders. We have a team of very highly specialized speech language pathologists who work, with ranging from the pediatric population all the way to the adult population. With that, before we go into the topic, I'd also like to congratulate Autism Connect for the commendable work that they're doing, in creating awareness among parents and among professionals. If there are any glitches today, please overlook them, because this is the first time I'm doing a Facebook Live. So if there is anything, if you have any questions, please feel free to ask me. With that, let's start for today. I'd like to start, before we go on to the causes, I'd like to talk about why do we eat. I want you all to give a consideration about that. Okay, why do we eat? We eat not just for our nutritional purposes. Eating is not just a mechanical activity that we all do. It is also serves a lot of social reasons. Now, if you look at an infant, the first interaction that they have in among all the activities that an infant does, one of the first activities or the activity that involves maximum time and interaction with the parent is feeding. If you look at an older child, the initial social bonding that happens with the parent or the caretaker is over meal time. So during meal times, a child is just not eating. They are learning a lot of other skills, such as waiting skills. They are learning turn taking. They are learning how to anticipate an event, like they see their mother going into the kitchen, so they know there's going to get something to eat, so they start anticipating events, and it becomes a very strong bond with the person who is feeding them. Then as you go on to a little older children, when you go on to older children, you will see that feeding serves as a purpose of developing social bonding among children, in terms of you organize play dates for them. You call the children over for lunch. A lot of friendships are formed over mealtime. From here, let's move on to basically the development of feeding skills. Now, how does feeding develop? Feeding, if you look at feeding, among all the activities that a child is learning during the initial 2 years, one of the most complex activities that they learn is feeding. Now, why I say it is one of the most complex activities is that apart from developing how their feeding development, they also are developing motor skills. So let me tell you, first a baby starts off with milk, that is the liquids. From liquids they transition to pureed foods. That happens around 4 to 6 months. From pureed food, a child transitions to mashed food, like mashed bananas, mashed potatoes. From mashed foods, you transition into soft mechanical foods, like boiled vegetables, boiled fruits. That soft mechanical foods are happening between 9 to 12 months. Then they move on to hard mechanical foods. Now, so going along with that, parallelly, as they are learning to transition from liquids to purees, they are accepting more textures. Also, side by side, what is happening is that they are developing their oral motor skills. So when they are in the initial phase, they are just learning how to suckle with liquids. That's all you need. When they go on to pureed foods, when they're sitting upright, they learn how to, from 6 months onwards, they learn how to either handle their feeding bottle, or they learn how to handle a cup, or learn to handle a spoon to the mouth. Now, in certain I'll give you an example here. What happens sometimes is, in our children, when they have some kind of difficulties in transitioning between foods, like we have, for example, a 3-year-old who's still on pureed foods. If the child is still eating pureed foods, then the skills that they should develop, like biting, chewing, proper rotatory chewing, which is completely developed in a child by the age of 2 years old, gets missed out because they have not yet made the transition with food. So all these things go hand in hand, right? And that's why I say it's a very complex activity that the child learns. Now, as we go on to the causes, let's understand our feeding system. Okay, so now just envision your digestive tract. We start with the oral. Alright, so from your mouth, then you have your pharynx here, it's called the pharynx. Then you have a long pipe that goes all the way down called the esophagus. Then you have your stomach, you have your intestines, then you have your rectum, and you have your anus. Okay, so throughout it's a single pipe, and it has a couple of valves everywhere to shut off. So when you put food in your mouth, there's a valve that prevents the food from coming out again. So your first valve is your lips. Your second valve is back here, okay, to prevent food from going into the nose or coming back into the mouth. Your third valve is here, which prevents the food from entering into your lungs. Okay, and likewise you have another 2 valves at the level of your stomach, okay, which prevents the food from the stomach, once gone in, to come back into your esophagus. Okay, so that is basically your digestive tract in very simple terms. I always want you to envision a tube with lot of valves everywhere for shut off. Okay, now moving on to causes of feeding issues in children with autism in specifically. What has been seen, there are a lot of studies being done, and it has been seen that children with autism are highly prone to gastrointestinal disorders in comparison to typical children, and also in comparison to children with other disorders, like children with Down syndrome or cerebral palsy. So in comparison to all these children, it has been seen that medical issues in relation to feeding are the highest in children with autism. So some of the I'm going to just mention a few disorders, that these gastrointestinal disorders that these children have. One is the celiac disease. Now what the celiac disease is basically a reaction or an inflammation that takes place in the stomach because of some allergic reaction to food, especially gluten. Okay, so that's why a lot of parents, even in whose children have autism or who have autism traits, have already been advised to shift to the GFCF diet, because the gluten and the casein has a kind of protein that reacts in the gut, which causes in the stomach, which causes some kind of inflammation, and which leads to the celiac disease. The other thing is called as the colitis, Crohn's disease, eosinophilic esophagitis, that is inflammation over here. So basically inflammation happening anywhere in your stomach, in your esophagus. Okay, any kind of inflammation makes it very difficult for your child to eat. One of the other very common issues, okay, GI disorders that are seen in children with autism is GERD, that is a reflux disorder. Now even infants till the age of around 12 to 15 months have a reflux. It is very normal for infants to have a reflux, but after that, after the child's system matures, the reflux reduces. But in children with autism, it is found to be prevalent across a very long period of time. Alright, so GERD is a reflux disorder, and all these disorders, all these inflammations basically cause a feeling of a blockage in your pipe, and that's why a child shows food aversion, That's why they do not want to eat their food. Okay, they show lack of appetite. Now, over here, let's move on. I'm just looking at my slides so that I don't miss out on anything. Yes. Okay. Now, if your child is having any kind of inflammation, what are the symptoms that you would see? Now, some of the symptoms you would see, if a child is expressive, they might constantly voice abdominal pain, or they might have repeated belching. Okay, they might have a bloating of the gut. You can observe the gut if they have a bloated gut. They might have constipation or diarrhea. They might have excessive flatulence, nausea or vomiting, or even, like I said, reflux. There was a very interesting study that was done they studied in 2019. There was a survey that was done, and it studied 340 children with autism. And what they found was that among all the symptoms that I mentioned right now, constipation, diarrhea, bloated, belching, vomiting, the maximum GI disorder that was seen was constipation. 65% of them had constipation, 30% experienced diarrhea, and 23% has nausea. Okay, so that shows that one of the biggest symptom you would see for any kind of disorder, GI disorder, is probably constipation followed by diarrhea and nausea. Now let's talk a little bit about autism. So you know the symptoms, you know what are the disorders. Now how does a child who has autism also has a part, let's take off the feeding issue now. Let's just think of a child who has autism. Now how do we diagnose a child with autism? They show certain behavioral traits. They might be aggressive, they might have anxiety disorders. So behavior, they might lack communication. Also they might have a lot of sensory issues. Now these are some of the traits of autism. And so these are the traits of autism. And a child who is having any kind of feeding issue, like due to maybe a medical reason, maybe because of a sensory issue, okay, and they are not able to talk. So a lot of time what happens is the parents, the feeding related issues get overlooked, because a lot of time the behaviors that they show is linked to traits of autism rather than a child having any difficulty with feeding. It's overlooked by the parents or by the clinician. And so if you have a non-verbal child or a child who is not able to express themselves, how would you know that your child is having some kind of medical related feeding issue or sensory issue? So I'll give you some behavior signs. One thing is you might see excessive aggressive behavior like head banging, biting. They might show a lot of anxiety. You might see a child has trouble sleeping, hyperactivity, there is lack of focus, there is a lot of inattention, and in general with food they might show a lot of food rejection and aversion. There are some more further detailed signs, such as when your child around meal times that you could observe is excessive coughing that is happening, or children who might tap on their chin or tap on their face. They might apply pressure on their abdomen. You might see them chewing their clothes, their fingers. They might hit their jaw, or they might grind their fists. And some children who are experiencing a lot of pain, what they do is they might tend to eat too much, because they feel that when they eat too much it might relieve their pain in some manner. Okay, so these are the signs that you should look out for. Alright, now how would you say that it is not a part of autism, and how do you differentiate it that it is a medical or a sensory related issue? So This distinction can be made by the help of a professional, a feeding therapist, okay, or a GI doctor. And further, as parents, how you could note this is that you're taking your child for behavior therapy because you're seeing all these kind of behaviors in your child, and you advocate it because they're autism, they have traits of autism. So you're taking your child for behavior therapy. You are giving them sensory integration therapy with an OT. In spite of all these therapies, if your child still is showing a lot of these issues, behavior issues, then it becomes imperative for you to consider some kind of food test for your child, or to go to a GI doctor. So these are the medical signs. Next, I'd like to go on to nutritional issues. Now, with the nutritional issues, children with autism are very picky eaters. Parents report that they have a very restricted diet. Okay, they might eat food only based on a particular color. Some might prefer only crunchy food. Some might prefer only soft foods. A lot of them might show a strong preference for food with high amount of starch, or food that is very high on sugar. They prefer only snack foods. So they have a very restricted diet. They might also sometimes completely eliminate certain food groups like fruits. They might not eat fruits at all. They might not eat vegetables at all. Besides that, a lot of them are on certain diets because, as we talked about in the medical reason, most of the reactions that you are seeing in a child, okay, most of the inflammations are a lot of time attributed to some allergic reaction because of the food they have eaten. So parents have observed that and then started eliminating certain foods from the diet like gluten and casein, and they put on certain diets. So now the issue here is, so the children are on a GFCF diet. They personally have a lot of preferences of their own. They have already cut off a lot of food from their own diet, and they are on this diet. So what happens is they are missing out on a lot of important nutrients from the diet. For example, if they're not eating their fruits and vegetables contain a lot of micronutrients. Micronutrients could be, like their vitamins, zinc, their irons. So they are missing out on all these foods. Okay, and some of the signs then that they might exhibit because they're missing out on all these nutritions, you might see that the child is losing weight very rapidly. They might have they may be malnourished. They might experience some kind of fatigue whenever you're trying to teach them. They might lack attention. They might not be able to concentrate on their learning tasks. So these are the behavioral exhibits. The what you might see otherwise in terms of physical exhibits is again because they're not eating fruits and vegetables, not enough fiber going in. They might again lead to constipation. Okay, and again constipation might lead to all the behaviors that we talked about. So you see, everything is so related, and that's why food and diagnosing that your child has some food related issue is extremely important, because it could affect their total well-being. Okay, so we've talked about medical reasons, we have talked about nutritional issues, and we'll move on now to the sensory issues. Okay, now let's take a break from all the medical issues and everything that we talked about. Let's go to the senses. Now I want you to, food generally we consider at the level of the mouth. If your child is not, you're feeding them and they are not eating, they are pushing their food away, they are rejecting, they're crying, they are throwing tantrums, we only advocated to that they don't like the taste of the food. We forget the whole other sensory inputs that the child is getting, and they're not able to regulate it. So I want you to envision yourself in a restaurant. Okay, when you are at a restaurant, so all your senses that are getting stimulated is your auditory sense. You are probably listening to music, you're listening to people talking. Okay, you are smelling different foods that are being passed around. Okay, and you are looking at the different foods come in and go, and only ultimately you get your food at your table, and then you do the tasting. So you see how later on, tasting comes in the hierarchy of your senses. Okay, now so let me tell you all the senses that are involved in feeding. There are 8 senses that play a very important role in feeding. Before we talk about the senses, I would like you to understand sensory processing. What is sensory processing? I talked about our scene in the restaurant. So you are constantly being bombarded, your senses are being bombarded with so many stimuli. Okay, now what your brain does amidst that is it filters what it has to take, it keeps the relevant information, and it discards the information that is not required. Okay, and then you react. So that is called sensory processing. You get stimuli from all your senses. Okay, it goes to your brain tries to understand that, keep the information that is important, reject the information that is not important, and then react accordingly. Okay, now in either of these steps, if something goes wrong, then you would say that the child is having a sensory processing disorder. Now a lot of time autistic children show some amount of sensory processing disorder, and that affects also their meal times. That is, it affects how they experience their meals in comparison to how a typical child might experience their meal. Okay, so I'll quickly go through the senses involved in feeding. One is vision, okay, one is touch, tactile, the other one is smell, olfactory, the other is gustatory, that is to do with the taste. Then I talked about auditory. You have the proprioceptive. Proprioceptive is basically pressure, okay, awareness and orientation in space. So where you are, it is to do with your sitting, your posture. Okay, and then you have the vestibular. The vestibular sense helps you with the balance and orientation. Okay, and the final 8th sense, which is really talked about very less, is the sense of interoception. It is the ability of the body to read and interpret the signals that it gets inside. Okay, like interoception, the sense of interoception would tell you whether you are, your stomach is full or you're not full. A lot of times parents say, my child doesn't express hunger at all, or they don't feel hungry at all. They don't express pain. So that is the sense of interoception. So these are the 8 senses that are involved in feeding. I'll quickly run through how a child would react if they have any of these sensory issues. Now suppose a child has a visual sensory issue. Okay, in respect to food, so you might notice that a child might only prefer foods of certain colors. When they see certain foods on their plate, like a preferred food kept along with a non-preferred food, they might reject the food completely. They might like only certain portions of food. They might, okay, so that is to do with vision. The next is to do with touch. If a child is having any sensory issues with touch, what parents usually, report is that their child refuses to touch the food with their hand. They refuse to get messy. They don't like, using tools. They prefer somebody feeding them. Okay. If they have an issue with smell again, and if that smell is heightened, For example, they might, even by the smell of food, they might start showing a lot of anxiety. Okay, now these are overreactions to the stimulus. There could be underreaction also, like they smell all the food that they eat. Okay, then is taste. If the sense of taste is affected in a child, it could be either hyper or hypo. Hyper, if it is hyper, then they prefer only soft foods. Parents will say that my child likes to eat only soft foods. If if they are hypersensitive, okay, to any input that is coming into their mouth, if they are hypersensitive, then they would prefer only soft foods. If they are less sensitive, hyposensitive, then they want more. So they want strong flavors in their mouth. They want, they seek, crunchy foods in their mouth. If the child has any difficulty with their vestibular or proprioceptive, you would see that, to be able to enjoy a mealtime, a child should be able to sit in one place. And if the vestibular and the proprioceptive sensory issues are affected, then they might have difficulty just sitting in one place, or sitting alert, maintaining the correct posture for eating. All these things might be affected. So my final thoughts, so what we saw in this is that we saw some medical causes, there could be sensory causes, and if you see that the signs and symptoms can overlap. So it is very important, that if you start seeing traits of autism in your child, if your child is already diagnosed with autism, it is very important that apart from starting off your speech language communication therapy, apart from starting off your occupational and behavior therapy, it becomes imperative, I would say, to get food testing done for your child if they're showing a lot of behaviors. Okay, so a feeding therapist should be a part of your child's team from the very beginning. In fact, there was a couple of studies I'd like to state. There was a study that showed that children as young as 6 months did not showed signs of rejection and food aversion. Okay, as early as 6 months, where they did not transition from pureed food to like textured food. Okay, so they're showing signs so early. So as parents or as clinicians, if we can make an early diagnosis, it would really go a long way in helping the child incorporate more food into their diet. Like I said, 0 to 2 is the very crucial period of feeding development in children. Okay, they're also going through a phase called the neophabic phase between 0 to 2. What is neophabic phase is that they are developing a very strong sense of I like this food, I don't like this food, very strong sense of preferences. So it is very important that when they are developing that sense, they should be exposed to a lot of textures of food. So it will go a long way in accepting a lot of varieties of food as they get older. And so as parents and as clinicians, my final thoughts are: observe behaviors before meal times, during meal times and post meal times. Try to, with the help of professional, make a differential diagnosis of whether the behavior traits that you see in your child are a part of them being in the autism spectrum, or are these signs and symptoms of some causes, medical or sensory causes, in relation to food. Okay, another very important thing is avoid force feeding your child. Okay, because very early on, as we don't at 6 months, generally a diagnosis has not been made for a child with autism. Okay, as parents are not aware. So a lot of force feeding happens. So if you start seeing traits of autism, respect your child's food preferences and seek help from a feeding therapist and an occupational therapist, so that you could gradually, with the compliance of the child, increase more textures into the child's diet. So going step by step, we use certain techniques like desensitization, food chaining. So please, go back to a professional as early as, as soon as a diagnosis is made. Another thing is, you could get food aversion tests done. You should consult a nutritionist and a dietitian to compensate for the nutritional deficits your child might have. You should go back to your pediatrician. A GI doctor should be someone who should be on your mind very early on. And so these are my final thoughts. If you have any questions, I can answer. I have tried, this topic is a very elaborate topic, and I have just given you an overview of it. But the sensory issues, for each sense, there are signs and symptoms. For each medical issue, there are particular signs and symptoms which could be talked in a very elaborate form. So if you go next time to your speech language pathologist, who is also a qualified feeding therapist, a detailed assessment should be made along with speech language and communication. So I'd like to end it with that. Any questions? Okay, if there are no questions, I will end it here. And if you do have any further queries, please feel free to get in touch with me, and we'll try to help you out in any feeding issues that your child has. Okay, thank you.